Approximately 3 to 6% of the population that's struggling with some sort of histamine issue. But the reality is we need histamine. It is something crucial for us to stay awake. That's if you have the appropriate amount. I actually think that histamine intolerance is overdiagnosed. It's partly self-overdiagnosed, but I also think in functional medicine, I think it's overdiagnosed because we're only looking at it from the enzyme perspective.
When it comes to the histamine diet, we'll see people who say you have to eat a low histamine diet for life. Do you agree or disagree?
Jennifer Fugo
is a certified nutrition specialist dedicated to helping people who feel failed by conventional medicine finally find relief from chronic skin and gut issues.
Through her virtual practice, she works with clients worldwide to tackle conditions like eczema, psoriasis, rosacea, and hives,
offering real solutions beyond just symptom management.
As the founder of Quell Shop, a skincare and supplement line designed for chronic skin sufferers,
and the host of the Healthy Skin Show podcast with over 1.1 million downloads,
Jennifer is on a mission to empower people with the knowledge and tools to heal from the inside out.
So we actually have two enzymes in the body that break down histamine, DAO, and then HNMT. So DAO is our primary histamine breakdown in terms of
it is very, very important. Whatever you put at the end of your fork is input to the body and is supporting those systems. What foods are most problematic for people who are struggling with histamine issues?
There are histamine foods that are considered low histamine. Either they have low histamine or they...
Welcome back to the Dr. Brighten Show. I'm your host, Dr. Jolene Brighten. I'm board certified in naturopathic endocrinology, a nutrition scientist, a certified sex counselor, and a certified menopause specialist. As always, I'm bringing you the latest, most up-to-date information to help you take charge of your health and take back your hormones. If you enjoy this kind of information, I invite you to visit my website, drbrighten.com, where I have a ton of free resources for you, including a newsletter that brings you some of the best information, including updates on this podcast. Now, as always, this information is brought to you cost-free, and because of that, I have to say thank you to my sponsors for making this possible. It's my aim to make sure that you can have all the tools and resources in your hands and that we end the gatekeeping. And in order to do that, I do have to get support for this podcast. Thank you so much for being here. I know your time is so valuable and so important, and it's not lost on me that you're sharing it with me right now. Don't forget to subscribe, leave a comment, or share this with a friend because it helps this podcast get out to everyone who needs it. All right, let's dive in.
Chronic skin rashes, gut symptoms, migraines, these things might not be random, but may be linked to histamine. How many people are estimated to be struggling with histamine issues?
It turns out that there's approximately 3 to 6% of the population that's struggling with some sort of histamine issue. And I think it's really important to know that it's not like an on-off type situation. You can have shades of gray. So some individuals might notice like, oh, I eat certain foods, like fermented foods, for example. And all of a sudden I'm getting really stuffed up. I start getting a headache. Maybe you're getting a little flushed. Whereas another individual might eat even the tiniest amount. And all of a sudden their whole body is going into a whole type of really extreme reaction where their skin will get really red, they'll get very itchy, they might break out in hives, they could feel like they're coming down with something, developing a headache, all these sorts of things. So again, it really is this gray scale where someone could fall. And that's where I think this whole conversation is the most interesting, because when we just think about it as like, do I have this or do I not have it? I mean, that's nice, but when you understand the severity, that's where we can really get targeted in like how to help these particular individuals.
Yeah, I'm going to want to get more into the fermented foods and different foods that can trigger this. But before we go there, I want to get everyone on the same page. So let's just start with the basics. What is histamine?
So histamine is a biogenic amine. It's basically a chemical in the body that is not inherently bad. I love to get out of the black and whiteness of the wellness world. And I think this is one area where people are like, oh, histamine is bad. It's bad for you because it causes all of these reactions. But the reality is we need histamine. It is, I would describe it as something crucial for us to stay awake, to be alert, to show up. Now that's if you have the appropriate amount, right? Too much could keep you up at night and cause insomnia. So I think that's a crucial piece. Our body makes it. There are foods and things in the environment that can either trigger the release of histamine or have high histamines in them. So where it comes from can be from a variety of different aspects, but it is really important for us from a physiologic standpoint to be healthy. So it's not good, it's not bad, it just is what it is.
Yeah, I mean, this is a lot like the conversation about hormones. Some people are like, estrogen's the devil, estrogen's the best thing ever, I don't want to be without it. And I think we see this conversation with inflammation a lot as well. We had Dr. Nawaz Habib that I know you know. I'll link to him. We talked a lot about inflammation and that perspective on it. And histamine came up in that conversation. That's why I was like, I need to bring you on. We need to just have that histamine convo. You brought up hives. A lot of people think histamine, allergies. Histamine, you're going to be, having seasonal allergies, or maybe you're even having severe allergic reaction. I think peanuts is one that a lot of people are familiar with. So help us break down the nuance. When people are talking about histamine intolerance, mast cell activation syndrome versus allergies, what is, if you could break that down so people understand the difference.
I would say that there are different buckets. And again, it's about the gray. Where do we fall? And two things could be true. You could have histamine intolerance and have like an IgE allergy to peanuts, for example. So it's not like you have one or the other and that's it. It's a little different with something like mast cell activation, where that's the super severe end of the spectrum. And you could have allergies at the same time. But in general, histamine intolerance is sort of where I would say this world and conversation really begin. Because at the end of the day, you are reacting to histamine in your body in a way that is not, I want to say, it's not normal. You're having experiences because of the environment, and that environment can be external, it can be internal, that create a scenario where your body is not happy. And you know it. If these individuals who are experiencing this know it because of the variety of symptoms that they experience. So like I said, that person who might eat some sauerkraut, they might go, oh, I'm starting to get a headache. I feel like I'm starting to get some heart palpitations and I'm getting a little itchy in spots. Whereas someone with mast cell activation, anything could trigger it. It could just literally be going outside of the studio where there's a significant temperature change. It could be the waistband of your pants is too tight around your skin. And all of a sudden you're welting up. You are super hyper reactive to sometimes even the most minuscule and nutritive things that most people wouldn't bat an eye at. Whereas an IgE allergy, which is,
for people who don't know what IgE means.
So that I wanted to actually preface this conversation because a lot of people don't understand what intolerance means. We mix up allergies, intolerances, and sensitivities. And that's just something that has happened over, I would say, the last 10 to 15 years. But they're different things. So an IgE allergy is on the spectrum where you are experiencing, essentially like somebody could develop hives from like erythromycin, which is an antibiotic. I used to get hives as a kid when I would take it. Other individuals who, for example, have like a peanut allergy or a milk allergy could end up getting really itchy, could have their throat swell up, could have their tongue swell up, could die because of anaphylaxis. So again, it's a whole range of issues. Some issues can be GI. So in those instances, that's where you're like, I need medical attention for this. You might need an EpiPen. You might have to go to the hospital. So an intolerance is different from that, as is a sensitivity. An intolerance implies that your body doesn't have this enzyme that's really crucial for a specific action. Most people understand lactose intolerance because they know if I drink milk, I'm going to get like bloated, gassy, maybe have some diarrhea, whatever. And they can take a pill and all of a sudden, hey, you can drink milk, eat cheese, what have you. And that is similar to histamine intolerance because of the DAO enzyme, which I'm sure we'll probably talk a lot about that. We have to.
We have to talk about it.
And so basically there's either we don't have enough of that particular enzyme to break histamine down, or there is some sort of genetic SNP that you have, that means that whatever copy of this enzyme that your body makes, it's just not as efficient. And so that can impact its ability to function correctly. So that is different from a sensitivity where we could have, so for example, like with gluten sensitivity, you're having more like a IgG response where we could have all of these symptoms that don't feel great, but you're never going to get to anaphylaxis, and it doesn't have anything to do with an enzyme. We don't have enzymes to specifically break gluten down, for example. So that's the difference. They're really different parts of the immune system. And that's why I'm going to say this now because I think it's important for people to understand where I've come from, because I've sat with this a lot. I actually think that histamine intolerance is overdiagnosed. It's partly self-overdiagnosed, but I also think in functional medicine, I think it's overdiagnosed because we're only looking at it from the enzyme perspective. So that's kind of my 2 cents.
If you think histamine intolerance is overdiagnosed, what do you think's actually going on that doctors are missing?
I think doctors are missing the fact that there is a histamine overload situation, which essentially means that you could have no SNP in your DAO enzyme or your genetics that are causing an issue with the enzyme. There's no issues with breaking histamine down. You just have too much. And it doesn't matter how much you supplement, you have too much. And your body's like, oh my, I think of like Lucy and Ethel at the chocolate factory from I Love Lucy,
one of
right?
my favorite analogies for what happens in the body.
I know. And it's like the conveyor belt starts going faster and faster, like shoving in their hats and down their blouses and in their mouths.
Eating it.
I know. And that's part of what's happening. But if we don't look at why you're producing so much histamine or what's causing this excess amount of histamine, then all we're doing is managing symptoms with diet, with other supplements. I think those things are important, and it's helpful to have bridges to help get you to a state where you're not suffering so much. But you shouldn't have to do that for life.
Yeah.
I mean, that's not, I mean, you love to travel. I love to travel. If you had to do a low histamine diet and travel to different countries, different cities, that gets really tricky. It starts to cause your life to get smaller and smaller and smaller. And to me, quality of life is just as important as all of this other stuff, because if we're not living, then what are we doing?
So when it comes to the histamine diet, we'll see people who say you have to eat a low histamine diet for life. Do you agree or disagree?
I mean, I don't think you should have to. That hasn't been my experience clinically. So I had all these clients come to me, and, you know, I work in the space of like chronic skin problems, and I was always so fascinated by hives, urticaria, angioedema, dermatographia, where like you could basically draw on yourself. I don't know if everybody knows what that is, but you could draw with a pen cap or even your nails. You could draw an X or a star, and your skin will basically kind of welt up. It'll look like that shape because it means skin writing. And so,
and angioedema, for people who don't know what that is,
like basically your skin swells up. So it's like you have welts, and even they'll describe hives as like wheels. So you could have like little pinpoints. You could have huge, big welts throughout, you know, your arms, your face, your head, and that can be really, really debilitating. And so I began to sit with this idea of why is it that we only have a diet management tool? Because it doesn't really change the end result. Yes, there are some people who do a low histamine diet for a while and they start to get better, and that's great. I'm super happy for them. But I don't know about you. I think the low histamine diet is miserable. I'm just being honest, because like I
don't think it's sustainable.
No.
I think a lot of the functional medicine diets that are therapeutic in nature should be temporary because you're treating something. And that I think often we saw this with AIP, autoimmune paleo. We have seen this with low FODMAP, and now we're seeing it with the low histamine diet, where people will cling on to it as if it is the holy grail, and if you just do this thing, it will solve all your problems. But I don't know. I mean, I would say you're going to have to like do a lot more to convince me to never eat an avocado again.
I mean, strawberries, spinach.
Yeah.
Oh my gosh. and the salami and cheese. If you go to Italy, you're just not going to ever have that. I mean, I don't know. That would be a tough sell for me. Mm-hmm. So I think as I sat with it, I thought, well, why all of a sudden? Because it's usually fairly sudden, and it might not be like an overnight switch turned on. For some people, it almost seems like it is, but it could be over the course of several months. You start to notice these weird changes that if you go to your doctor, like your GP might be like, I don't know what to tell you. Maybe take some antihistamines and just go with that. And you might notice that they help. Other individuals don't. And so I had this one client who she had such severe angioedema, hives, for about, I want to say it was like 6 or 7 months, that they put her on Xolair, which is the biologic type drug. It's sort of in that category, I guess, to try to help control. And on top of it, every day she was taking up to 8 doses of antihistamines with no improvement. She even tried doing a low histamine diet with no changes whatsoever. She still needed all of these antihistamines to help maintain barely a semblance of comfort in her daily life, which is horrible. And she even said to me, I'm at a point where like, I don't know if I can keep on going because this is awful. This is like literally my worst nightmare and a living hell. And so with these individuals, what are you going to tell them to do? Just keep taking more and more out of their diet? Yeah. The diet doesn't work for everyone. And as you pointed out, it's not sustainable. I mean, any diet book that you look at, there's several low histamine diets you can find online. And, you know, we have colleagues, friends who've written low histamine diet books. And you look at that and you're like, that's it. It's
a full-time job.
Yeah.
It's a full-time job to manage your diet and eat in that way.
And part of the reason is because the worse it gets, you can't eat leftovers. You can't eat processed foods. And processed foods can include things like protein powder or collagen. Yeah. And so that was where I started to really go down a rabbit hole. Well, if it's not the food, right? If it's not just allergies, because there's also people who've had these huge skin prick panels with allergists who are experiencing these issues and have nothing come back wrong. What do you tell that person at that point? Okay, you have no environmental, you have no food allergies. The diet is not really helping. You're on tons of antihistamines, which, by the way, some of them have pretty significant long-term brain impacts.
Yeah, they're associated with cognitive decline.
Yeah.
It's not a mess around kind of pharmaceutical.
No. And so then what else is it? Like, what else? I mean, there's just like, seems like there's no hope for these individuals other than, well, we hope that you'll just like, in maybe a couple of years, your immune system will shift and maybe it'll go away. We don't know. Or we'll develop some drug like Xolair was like the thing that they thought would fix everyone, and it doesn't. It doesn't help everybody. So that's why I think we have to ask the question, what is filling this histamine cup? What is causing it to so easily overflow? And when you ask that question, you get vastly different answers that you can actually do something about. And I recognize that in conventional medicine, it's not, they're just like meds. Okay, maybe change your diet. Don't go outside. Don't be exposed to allergens, but we're not sure what exactly it is. Don't get stressed out. I mean, that's not living. And so I think that's where this whole conversation gets really interesting.
Absolutely. So the diet, it has a time and a place, but it's not going to help everybody, and it's not sustainable long term.
No.
But you just mentioned that when we ask the question, like, why do we have so much histamine? We get different answers. What are those different answers?
One of the things that I realized is that, so in the health space, for example, we have our liver, which is wildly important for so many different things. I think we, as a whole, do not fully understand what detoxification actually is. It's really the transformation of different molecules. One gets converted to another. And there's different reasons for why that can happen. Some of those things are like vitamin D, for example. Estrogen can get turned off, so we can actually help shuttle it out of the system through bile and whatnot. But if we don't have a healthy phase 2 liver detox functioning, that's where we have methylation, our glutathione pathways, our glycine pathways. And when these get overrun, it's all of a sudden like we're really struggling to deal with this in a way that our body needs to. It has the capacity to do it, but we have to ask why. And specifically phase 2 liver detox is run on nutrients, many of which that our body may make. So when we have issues with our phase 2 liver detox, it makes it very difficult for our body to handle transforming really important things. And part of what goes through phase 2 liver detox are toxins. And those toxins can come from the outside world, but many of them come from the GI tract. And so we need nutrients in order to do this detoxification for, like I was saying, our glutathione pathway, our glycine pathway, sulfation. I mean, we have many really incredible pathways there. And if you in your best intention are limiting your diet, all of a sudden we now are restricting the amount of nutrients coming in. And maybe you're at a point where you're also really sensitive to supplements. So you can't even add it in through a supplemental form. And that's where your liver's like, whoa, I can't handle this part of things. Then on the flip side, what happens if you do have a few allergies and you're like, oh, I read online I should support my liver detox and I'm allergic to ragweed. Do you know what's in most liver detox supplements? Milk thistle. That's a ragweed family thing, ragweed family plant. And so you could be—
I just want to say, you just highlighted again, I want to underscore this for people. Milk thistle is awesome.
It is.
Detox, and it actually helps with the cellular regeneration of the liver, but it's not for everyone.
Right.
And I feel like this is a theme that has come up a few times, and I really want people to take that home. But I'm slowing your roll.
No, it's fine.
On the liver detox. I do want to say, though, when you said the I Love Lucy and the chocolate factory, that's what I think of when I think of phase 1 and phase 2. And whenever people are like, oh, I did a detox and I felt so bad. And I'm like, I would bet money you were pushing phase 1. And there's Lucy, unable to keep up in the phase 2. And the intermediates that go from the liver. So for people to understand, liver has phase 1. The intermediates are actually very toxic oftentimes because then it has to go through phase 2. So what you're talking about isn't just the inability to clear things that have come in or the body's produced itself, but the inability to neutralize more toxic intermediates. I'll let you keep going, though, with your liver explanation of what's going on with histamine.
And I 100% agree with you. I oftentimes, when I talk about this, I'm like, it's like Ethel and Lucy and the chocolate factory. It's like the best analogy. And so the other piece is that a lot of what comes from the GI tract, specifically benzoates. So if you look in the food supply, especially foods that are more processed, they'll say like potassium benzoate, and it's usually added to food as a food preservative. And there are benzoates naturally occurring in foods, but what is produced in your gut is massive. And that jumps the line. It goes right to phase 2. So if you're already handling a heavy load, or you upregulate or speed up or put the gas pedal on phase 1, and you don't have, I like to call them the bonbon wrappers, because it's like that's what the nutrients are.
I love your delicious analogies. I just want to say that chocolate factories, bonbon wrappers, I'm here for it all.
But like if you don't have enough of them, your body's not just going to find it someplace else. Our liver's not a fish filter. That is one of the biggest grievances I have with how things are described online. Your liver's not a fish filter. It doesn't just suck things up and filter it out for you. It actually does a lot of things. It has some amazing capacities, but it requires nutrients in order to do it. And like the glycine pathway, for example, is one that does require nutrients. And yes, glycine is readily available in a ton of foods. However, and I don't know why this is, I don't have any data to back this up, but I tested this out repeatedly with clients. It did not matter how much we increased glycine consumption in food. So we would say, hey, just increase your collagen intake, right? That seemed to like the mathed, except it didn't seem to make any difference. And so then I was like, okay, let's just try supplemental glycine, like focusing on these more therapeutic dosing, which starts at around 3 grams a day and can go all the way up to like 10 grams a day, depending on severity. And we notice that for some reason seems to get better results. I don't know why. I don't know if it's that the body's like, oh, the glycine and collagen, we know what to do with it. We're going to put it in these other spots. Because there's no guarantee when you take something, it's going to go where you want it to go.
When you say better results, like what kinds of things do you observe?
So we notice that people tend to be, like, for example, less reactive to salicylates, which is a totally other type of food. It's a phytochemical that some individuals become reactive to. And a lot of times it's also described as salicylate sensitivity or an intolerance, but it's actually not. Most people think it's a gut intolerance, but it's a liver detox issue, because if you're sensitive to salicylates, salicylic acid is processed down the glycine pathway. And so you need more glycine in order to you need the bonbon wrappers, right?
Yeah.
To wrap it up, process it, and get it out without having reactions. So people will notice an improvement in their skin. They'll notice an improvement. And this includes eczema, psoriasis, even urticaria and hives and dermatographia. They'll notice that in general, they seem to just feel better. They're less reactive to things. Their skin clears up faster. Obviously, that's kind of the wheelhouse that I work in. But they do notice that their rashes will be less red. Some individuals, I'm not going to say it's magical because nothing is magical. Sometimes that crucial first step, you're not going to notice a drastic improvement because you've got so many other layers of things to address. Like in this histamine intolerance or histamine overload situation, usually there's a lot more that we need to do. But this is a crucial first step. The next thing is, I mentioned the gut. There's a huge gut impact.
Wait, before we move on to the gut, I want to ask you a question.
Please.
You're a licensed nutrition professional. What do you say to providers who say, your liver has the capacity to detox, therefore there is nothing you need to do to support your detox pathways? It just happens on its own.
I mean, the problem is, it is in every single, you could look in any textbook, you could look on PubMed. It's very easy to find that these pathways, specifically in phase 2, require nutrients.
Okay.
And so that's great. Yes, they do have the capacity to do that, and they need the nutrients to do that. So who's to say that the nutrients that you should get from the food you eat is even being absorbed? There can be issues, for example, with digestive dysfunction, where you might eat meat, for example, which does have usually a good amount of glycine in it. But what if you don't have enough stomach acid? You don't break the proteins down into amino acids? What if then you have celiac disease that's undiagnosed? Or you just your gut is super, super unhappy because of overgrowth issues and whatnot. And now you're not absorbing things the way that you're supposed to. So we can't assume that what we eat, unfortunately, is actually making its way in. And if there are nutrient wells that are really dry, you can't expect the normal amount of nutrients that a person who is healthy, who is in a robust state, that's going to fix the problem, because we have a well to fill up. So I understand and hear them. I'm not saying that the liver doesn't have the capacity to do it. I'm just saying the liver needs some support.
Absolutely. And I think that it is actually a very dangerous statement to make blatantly. Like, when you consider the standard American diet and how nutrient devoid it is, and how many people are consuming processed foods that aren't even getting things like cruciferous vegetables, which we know are essential to liver detoxification. Maybe they're not eating, maybe they're vegan and they're not getting the right array of amino acids. And so to be so flippant of like, your body has detox pathways. Well, it's like, I always think, well, yes, your kidneys can detox, but if you don't drink water, no, they actually won't. So there's inputs that have to happen. And I think for people listening, it is very, very important. Whatever you put at the end of your fork is input to the body and is supporting those systems. Okay, so we covered liver detoxification issues can be one cause of this histamine overload. You were moving on to the gut.
Oh, the gut. There's the gut. Actually, I think I would love to talk a little bit about environmental issues first, because obviously it impacts our liver, but it also can impact our mast cells, and we can breathe in things like chemicals, allergens. I mean, especially for those who are high, like you've got really bad hay fever and allergies. Obviously, that's going to impact things as well. As I had mentioned, if you have specific allergies, you should be aware that there's that possibility of cross-reactivity. That's why I mentioned, we talked about the milk thistle.
Ragweed. I love
exactly.
that for people. Yeah.
So just be aware of that. That, unfortunately, might not be something that you can do, and that's where we want to look more towards just general nutrients to help support the liver instead. So, so we have environmental allergies. Mold can be a factor. And I'm not going to sit here and fearmonger about mold, because I think the way we have conversations about it is really, like, to me, it's sad, because your system is already overwhelmed. And now you're throwing on top of somebody, oh my gosh, you might have mold in your house. You need to move. You need to burn all your things. And it's like, I just want to feel safe.
I will also say that I think people who have legitimately had mold in their home, it is so traumatic. And I don't use that word lightly. It is so traumatic. Like, there's, women who have had multiple miscarriages. There's people that, they became very chronically ill. People lost their job. And then on top of that, then they have to remediate their house. They have to lose their stuff. And so for anybody listening, if you see somebody that it feels like they're fear-mongering with mold, I don't want you to go hate on them. I want you to have compassion for the fact that, like, that was incredibly traumatic. And I think they very much want to warn everybody. Because if they had known and they could have prevented it, that's what they would have wanted.
100%.
But I think you're right that there are other people who it wasn't necessarily their experience, but they're selling great programs for mold. They've got an affiliate for testing your house, and they're literally telling everybody, everyone has a mold issue, which we know is not true.
No, and some individuals are more, I hate to say it, but the cards we got dealt with do matter. So you might have some genetic SNPs that make it more difficult for your body to clear mycotoxins, whereas somebody else, I mean, I work with families where the wife is really super sensitive to even the most minute amount of mold. And sometimes there also can be mold allergies on top of that. So those are two separate things that can co-occur. But the rest of the family's basically okay. They're able to handle whatever that exposure is. And it may just be that maybe there's a little bit of a leak under the one toilet and it hasn't gotten too bad. Where it's a challenge is where we're dealing with a ton of black mold. Like, if God forbid you broke down the wall, I couldn't imagine in here. And you're like, oh my gosh.
It's concrete. There's no mold.
No mold.
I live in concrete houses.
But you were sharing with me about how you went on your honeymoon and stripped the bed and the whole bottom side of the mattress was covered in mold in a tropical area. And so we forget that, yes, we can live in a place where there might be a small amount of mold, and depending on your unique cards that you got dealt, you might be able to handle it. You might want to clean it up, but is it a 5-alarm? I think that's always the question is it really a 5-alarm fire? And that's where I get worried, even in this conversation, that everyone wants it to be a 5-alarm fire in order for it to be motivating. But the reality is nobody makes the best decisions when they're constantly in that fear state. Because we're missing the other data points. We're missing you could have mold in your car. It might not be your house. Literally, you could have mold under the rugs in the car and in the ventilation system. It could be your work. It could be your gym. So should you freak out and think, oh my gosh, I clearly have all these symptoms of mold illness, it must be my home. It might be someplace else. So again, having this mindful approach to it. So mold can be a factor because it can destabilize mast cells. Obviously, it's just, mold is its own beast. I'm not an expert in mold by any stretch of the imagination, but I do think that's a factor. And then also too, in terms of the gut, we have bacteria that can produce histamine. There are obviously parasitic issues, both protozoa and worms or helminths that can cause the more allergic side of the immune system to become elevated, like our eosinophils, which are one of the white blood cells, or our total IgE marker can get elevated as a result of them and kind of get confused with allergies. Also, fungal overgrowth or Candida overgrowth can also cause issues. Having SIBO, so small intestine bacterial overgrowth, can be a factor. Having an H. pylori or Helicobacter pylori infection in the stomach can be a factor. So many of these things play a role in this histamine bucket, and the overload that happens there's no amount of moving, right? If it's not, let's just pretend you're like, okay, it could be mold in my house. What happens with everything that's going on internally? You can't walk away from that. You're living in it. So that's where I started to think, well, what happens if we seek out the organisms that could be contributing to mast cells and basophils degranulating and releasing their histamine into the body? What could we do if we were to help reshift the microbiome so that your body could handle those things and you could regain tolerance again? And that was where, that's where I really find it fun and fascinating and interesting. I love being that sort of like a detective for clients because they're so exhausted. Yeah. And I just want people to know that there's hope. You don't have to be stuck that way. Like the client that I mentioned earlier who had angioedema and chronic hives for months and months on end, 8 antihistamine doses a day plus Xolair, she's on none of that now. She has no outbreaks. So it is possible to roll it all back. It's just you have to understand what the causes are.
I think people listening are going to be curious if there's other environmental inputs they should be aware of. So we talked about mold. Are there other issues that could be contributing to mast cells? So everybody knows mast cells, they basically have little pockets of histamine on them. And so when they become distable, I always think about this cell like freaking out, but it's like throwing confetti everywhere, but it's like histamine. And it's just like, I don't know, maybe the Oprah, like you get histamine and you get histamine going on. But, so in the mold context, I think that's like a really big extreme that people can, grasp. But are there things day to day that they might be coming into, encountering that's causing this?
So an interesting part of this could even be something as simple as temperature changes, could be sunlight exposure, like all the good things that you would think like, oh, let's go
do
cold
saunas
sauna.
And we're like,
be out in the sun. We should get our daily sun. And for some people that triggers a histamine reaction. Even wearing something tight. So it could be like the straps of your shirt, could be your waistband, could be anything elastic, anything tight around your feet or your neck, whatever. It doesn't matter. That can cause your mast cells to degranulate. And I love that analogy. I think of it like kind of like the fulfillment houses that have all the packages and they're floating around the body and all of a sudden something just like causes them to just dump all their packages everywhere. That's
UPS during Christmas. Forget it. I'm done. I'm going home.
So I know it's like, I think having some great analogies helps us to better understand this and in some regards to kind of laugh at times, which we do need to laugh. We do need to find joy because it can be really heavy. And I get that. I don't want anyone to feel like I'm minimizing their experience because like I said, I've worked with people that are literally at their wits' end. Like if this cannot stop, they're not sure how much longer they can go on because it's that bad.
Okay, so we've talked about you've covered the symptoms. I feel like maybe we should do a roundup of symptoms actually before I ask my next question because I feel like, you've said things from hives to migraines to insomnia, but maybe like a head to toe, like somebody taking an assessment of themselves, might I have a histamine issue? Let's do that. And then I've got some more questions for you.
One thing that I will tell you flat out in my clinical view, if you have hives or urticaria, any type, it doesn't even matter if it's the autoimmune type. If you have dermatographia or angioedema, you have a histamine problem, period. Like you don't need to look at the other symptoms and to figure out, do I have this? No, you do. Now it's just, we want to know the severity. Yeah. So those for sure, those skin symptoms for sure are a problem. I will say this about itchiness. You can get itchy in having a histamine reaction, but not all itch is driven by histamine. And so you cannot use that as a reason why you think you have a histamine problem. And most itch that occurs in eczema is not histamine driven. I actually interviewed Dr. Sean Quatra on my podcast all about this. He's like the worldwide expert in itch, and he works at the University of Maryland in an itch lab. And so they discovered that most itch is not actually histamine driven. But one factor to note that is helpful is if an antihistamine does help, that obviously is a good telltale sign that we have a problem. For example, if you were to eat something and you notice that you're starting to have like your throat gets itchy and your mouth feels itchy, you might get some GI symptoms. You could have maybe even like a little bit of heartburn. You start to feel like your heart is racing. You start to get a headache or even to a migraine. You have issues sleeping, maybe full-blown insomnia. You can also have other issues like POTS type symptoms, like autonomic issues. And then also those who have like Ehlers-Danlos, where you are hyperflexible, can be a factor in histamine issues. I've also had clients where they just generally don't feel well. They start to turn red, they get really flushed, and they feel like they're getting sick. So those would be some things that I would categorize as like definitely something's going on. But like I said, where I get worried is when someone like, they'll say, hey, I can't even handle like a little bit of zinc in a supplement. I can't take things that are nutritive where you become super hyper reactive to it. That's where you're sort of like headed towards mast cell issues. And that's where I think at that point you should be really working with a doctor, because you might need medications and whatnot to help stabilize some of those symptoms.
And from the hormonal perspective for people listening, if 5-7 days, maybe even closer to just 1 to 2 days before your period, you're like, I'm getting sick. I feel like I'm getting the flu. I'm achy. I'm feverish. That could be a sign that you're having issues with your histamine. If you've been diagnosed with PMDD, ADHD, endometriosis, we know there's certain conditions where histamine issues can ride along with them. And it's because you inherently have immune system dysfunction as it is. And so mast cells being part of the immune system, it's, not shocking, although some people are like, really dismissive that this could even happen, or patients who are like, no, but I take an antihistamine and I don't feel suicidal before my period. Yes, because histamine is also a neurotransmitter. It's not just affecting your gut and your skin and a lot of these obvious symptoms. It can be affecting your mood. But for people who are struggling with skin symptoms, we kind of pulled the hope away that like the diet's going to cure everything for everyone, right? What can they do topically to maybe get some relief if they're itchy, if they have eczema and they're like, yes, antihistamines do help, but like I've got a family history of dementia. I don't want to mess around with these things long term. Are there topical things that in the short run they can use to kind of get some relief? And then I want to start getting into like what you can do big picture.
Yeah. I think it's tricky because there's some more natural things you can do, and then you're sort of at this point where you do need medication. So zinc can be really helpful topically. It's in calamine lotion. For those of us that remember when we used to get mosquito bites and all sorts of things, poison oak, poison ivy.
I was pink like all summer.
Exactly. So that has zinc in it. So it can be helpful in that instance. So you could try like an organic diaper cream if you don't mind being like spotted white. It will make you look pretty pasty.
Bordeaux's butt paste. I'm a fan.
There are some other formulas that have less amount of zinc in it that can possibly be helpful, but that's one thing. I also like witch hazel hydrosol. It can be nice to just help kind of like break up the itch, as can anything cold. So ice packs, even like if you have like issues with your face, for example, you can get those frozen metal rollers that you can keep in either the freezer or the refrigerator and roll over your face if you feel like you're having an issue. And that can kind of calm things down, break the itch cycle to hopefully give you a little bit of relief. I generally would not recommend getting in a sauna or a hot shower. That seems to make things worse. And from there, most doctors then are looking at like steroid creams and other things to try and calm things down. So those are like the most kind of like natural. This is a really hard, that's why I said I have great empathy for folks who are dealing with this, because this is tricky. There's not a lot on the natural side that is just going to like jump in and save the day. There are things that can make it better, but at the end of the day, you are probably going to have to lean on some type of meds to some degree. And I just want to normalize that, because there's a time and a place for medication. I know in the wellness world, there's a lot of people that scream and cry out against medications, but that's nice when you're not in that boat. When you are struggling and that medication means that you can get through your day with some semblance of normalcy, I'm really hard pressed to understand why we would make someone feel ashamed for choosing a medication to help them, especially when it gives them more runway to be able to be the mom that they want to be, to go to work, to see their friends and family. I mean, even just to get outside to go for a walk. So those to me are the big things. And I also wanted to just mention progesterone can be a potential trigger.
Yes, it can.
You were talking about hormones and I was like, hold on, I need to mention.
Progesterone dermatitis is real.
Yes, it is. It is a serious problem.
I think we actually did an episode on your podcast, The Healthy Skin Show, where I talked all about that.
Yep.
So we'll link to that.
Yes. So that can be a factor as well. And it's considered rare. So a lot of doctors don't even look for it, and many have never even seen it. So they don't know what they're even going to look for.
Yeah. And for people who are like, well, why wouldn't my doctor look for this? The most case studies and most studies in general, it's IVF treatments that we see it. And so it's when you're using high dose and you're using vaginal suppositories, maybe you're doing IM injections or sub-Q injections of progesterone and you're getting those levels up. That seems to be the time that tips the scales for some people. It's also, during fertility treatments, there's a lot going on with immune system regulation that, for whatever reason, even just being put on oral steroids, there might be something coming into play there. So, but if you are somebody who's like, oh, when I, before my period, I start to know that I get hives and things like that. And it's not actually usually just before your period. It's usually 5 to 7 days after you ovulate when progesterone peaks. But when we most commonly see it is when we are high dosing with fertility treatments, which, by the way, for everybody listening, we don't use those high of doses when we're doing hormone replacement therapy. So everyone in perimenopause, we are not hitting you with 600 milligrams a day. It's 1 to 200 and sometimes even less than that. But I appreciate you bringing that up because there's a big interface between estrogen and progesterone and what is happening in the immune system in general. But we know estrogen's involvement, and I'm actually going to be on your show again, so you guys have to follow her. And I'm going to talk all about estrogen's involvement with histamine because I think it's so important for people to understand. So, and the other thing I want to say, just to your point about medication, I really appreciate it because I'm a fan of the tool, any tool for the right job, right? Whatever the tool is that we need. I don't want a screwdriver when I need a hammer. Often when I see people who are like, natural is better at any cost and shame people about pharmaceuticals, they do not have a license to prescribe pharmaceuticals. And so they're not actually trained to understand pharmaceuticals. They're not trained to understand how to actually go through the risk versus benefit, give a true informed consent on that. And I think it creates a bias. It even happens with healthcare practitioners who don't have a license to prescribe. They'll steer everyone away from medications because they have their own bias. And I think we all have a bias. It's inherent. But we have to be willing to recognize that and to always step away from the bias to say, is this actually what's best for the patient? Or is this just me having a bias around this? Now, as you bring this all up, I think people are going to have questions. I think the big question is going to be, is this a lifelong thing? Is there no getting rid of histamine issues? Am I just stuck with it?
I don't believe you should be stuck with it. I think mast cell activation may be a much longer road. And again, I don't work with that because at that point, I feel like you're going to need medication and a significant amount of medications. So having a physician on board that is very knowledgeable about mast cell issues is going to be really crucial. That being said, if you're in that sort of histamine overload bucket, and that could include histamine intolerance. I do think that you can reverse it. You could minimize it. Maybe you might have some lingering issues, but I do tend to find with clients that we work with, people who've gone through even my group programs, they're doing this on their own just with guidance, that they are able to reintroduce high histamine foods without any reaction. They're able to go about their life again, which is to me, that brings me so much joy because I know, when you can't do basic things, that is, it's not like you're going, I need $1 billion. No, you just want to go outside. You want to go exercise. You want to go to your kid's soccer game and sit on the bleachers and cheer them on without feeling sick. You want quality of life. And to me, when we can get that back, that is like amazing. And I mean, if you want to go like to Italy and eat some salami and some Parmesan cheese and have some fermented foods and whatnot, and you're just able to relish in all these amazing flavors and eat strawberries, like just simple things. That to me that brings me a lot of joy.
So speaking of salami and strawberries, what foods are most problematic for people who are struggling with histamine issues?
Well, I again want to clarify, there is a range. So there are histamine foods that are considered low histamine. Either they have low histamine or they don't cause a whole lot of histamine release within the body. We then have more moderate foods. That's probably more so where things like strawberries, asparagus, no, sorry, I misspoke there. Not asparagus. Strawberries, avocado, chocolate, all those different foods kind of lie. Where we
the awesome foods.
I know. I know.
Again, I brought up avocados, but you guys, I would be a liar. It's chocolate. Chocolate's the deal breaker for me.
Chocolate. I love chocolate. But where we get into the high histamine bucket, and then there's kind of like the beyond. So I'll start with high histamine bucket is our fermented foods, alcohol, aged and cured foods, things that are molded. So like blue cheese, for example, has mold in it. And that's where you have to be careful. Some berries, for example, are low histamine foods like blueberries, but if they're moldy, then no. So
do you recommend people wash their produce with like apple cider vinegar diluted in water?
I think those are great things to do just in general. I mean, there's a lot of, who knows what ends up on our food by the time it gets to us at the grocery store. So anything that we can do.
I always just think about whose hands ended up on my food and did they wash them? Are they singing happy birthday? I don't know.
Who knows? But anything that we can do, I think, is helpful. So any little bit of extra care and step is important. So anyway, those are a lot of the big ones. We mentioned fermented foods, pickled foods, vinegars, things like that can be a really big challenge. The bigger issue, so kind of like the upper end of the range would be protein powders, collagen, gelatin, so bone broth.
Yeah.
I mean, we talk a lot about how healing bone broth is.
Everything you're talking about right now, all these foods could be considered superfoods in some capacity. And so this is really the nuance of like what is actually true for you and how your body responds.
And when it gets really bad is where you cannot consume anything that's a leftover. And that is where most people feel like the wheels are flying off the car and they can handle it for a certain point until they can't. Because it's basically like if you were to cook hamburgers, for example, and you ate it right away, probably not an issue. If you let it sit in the refrigerator and you tried to eat it tomorrow or even later in the day, no bueno, not going to work, because as food sits, the amount of histamine increases in the food. Canned foods are another problem. So you can see, like, how do you travel like that? That's what I was saying. How do you take a trip? What do you bring with you? You can't bring meat sticks. You can't, most berries you're not going to be able to travel with. You could do some apples, but that's not very filling. So anything that's canned, anything that's pre-prepared is pretty much off the table unless it was frozen.
And airplane food is not going to cut it.
No.
That's going to be off the table too.
No. So you're going to be walking around the airport going, what do I eat?
Yeah.
And you're going to be really hard pressed to find something. So the leftovers are where it's usually like, I need to make a change. I need to do something. I really would prefer people don't get to that point, but we all reach out for help and start looking when we're ready for it.
On the flip side, what foods can help if you're struggling with histamine?
There are actually some foods that you can add to your diet that can help. So things that are high in quercetin, for example, which is a bioflavonoid, things like, and they're kind of reddish. So apples. You could do red apples, but you could also do Granny Smith apples. But we have things like currants, cranberries, blueberry. I know blueberries aren't exactly red, but they're kind of reddish. They're purplish. We could do like purple plums, red lettuce, romaine lettuce. We can do dark leafy greens, asparagus. And one really interesting thing that has actually a plant-based source of DAO is pea shoot sprouts. And so you could make like pea shoot pesto. Again, you'd probably want to make it fresh. And you could add that to your food, and that might be helpful in improving the digestibility from a histamine standpoint of your food. But adding pea shoots, I mean, sprouts in general are really helpful, but pea shoots specifically are they are a prime source of naturally occurring DAO.
Yeah, and this is something that you can actually sprout in a paper towel, like a wet paper towel on your windowsill. I always share that with people because like we've all been to college and we know what living in a dorm is like. And like even in these situations, because I think sometimes people, you know, you'll say things like pea shoots and people, because they've never seen them before, they think like this is completely, something that no one can access. And so I want people to understand actually you can DIY this at home pretty easily. You brought up alcohol. That's a huge controversial one, I feel like, in 2025 because of the, the acknowledgement of what we all knew of like, if you're drinking alcohol in excess, you're playing the Russian roulette of cancer, basically. What is alcohol doing though with histamine, and why are people getting flush when they drink it?
So from what I understand from research is that it increases our endogenous production or release of histamine, but it also is fermented. So it in and of itself is high in histamine. So it has this dual effect. And then some individuals also may not have, it's called an enzyme that's alcohol dehydrogenase. So they may have an even further difficult time breaking histamine down or alcohol down. And then the other factor is like, what happens if your gut's really messed up? What if you have fungal overgrowth? And there are organisms that produce alcohol in the GI tract, and now you're adding alcohol into it. Again, it just tips you right over into that bucket where you're like, I can't do this. So alcohol is something that when you're in a histamine overload situation, I'm like, listen, I'm really sorry. I like maybe once a month having a little bit of red wine with dinner, but like it's kind of off the table for a while. You've got to get things under control before you can add it back in if you want to indulge periodically.
You brought up the DAO enzyme. Let's explain what that is to people, and is it worth supplementing with it?
So the DAO enzyme is diamine oxidase. It is our only histamine breakdown enzyme within the GI tract. So we actually have two enzymes in the body that break down histamine, DAO, and then HNMT. That is our intracellular enzyme. So it's inside every cell, and it breaks down histamine inside the cells. So DAO is our primary histamine breakdown in terms of like what we're consuming, what is being produced within the GI tract. And it also requires copper in order to operate correctly. So if your diet is devoid of copper, you're taking a ton of zinc without balancing it, that can be a factor. And as I said, we can have SNPs, genetic SNPs that cause the DAO enzyme to not, work as well as it should. And some research looked at how many SNPs there are. It could be up to like 50. So, and look, could we have SNPs that maybe make it more potent? I don't know. It's possible. Who knows? But the reality is the DAO is crucial. This is where it's like, in theory, okay, you have too much histamine. What if I just supplement with more DAO to break it down? Wouldn't that math make sense? I wish it did, but what I found clinically is that most people don't find that additional DAO from a supplemental form is helpful. The one challenge, there are maybe one or two supplements on the market that might be plant-based, but most of it comes from pork. So if you have an allergy to mammalian protein, or you have an allergy to pigs, obviously that's going to be, or you're kosher, that's going to be a problem. I usually recommend that clients try it for about 2 to 4 weeks. And you have to be really honest with yourself if you see an improvement, and if so, to what degree. If it's like a little bit or you didn't really notice a difference, supplementing is probably not going to help. And it's expensive. And generally, you're supposed to take those supplements about 10 minutes before every meal, which most people have a hard time remembering to take digestive enzymes to begin with. So to have to time that is tricky. And again, it's an expense that if it's not necessary, I don't generally recommend.
Are there supplements that can help?
So there are. You can supplement with quercetin. Mm-hmm. I will just say this about quercetin. I love it. At the same time, if you take it for too long, so I would probably say too long would be maybe a year or longer. It's not in every individual, but I found that some clients start to have either some like weird thyroid things that begin to happen, or they'll have like blood sugar issues. I'm not sure why, and there is some literature to show that there's something going on there. So I think if the goal would be you use it as a bridge to help you get to where you need to go, but eventually we want to use it just as needed. And typically people take like 500 milligrams once or twice a day. Seems to be a pretty standard amount. There's also other bioflavonoids like rutin can be helpful, nettles, so stinging nettles, the herb, and you can also make teas and all sorts of things from it. That can be helpful. One of my favorites, and I apologize because I have no data to back this up, but I have seen this work clinically so many times, is immunoglobulins. Bovine serum immunoglobulins are so helpful. And I've asked there's one company in the United States that makes them. And I have asked them repeatedly if there's any research or anything to explain this, and they don't know.
Yeah.
My best guess is that within the GI tract, there is such a huge burden of endotoxins because it's really great at binding to LPS or lipopolysaccharides, that perhaps that's a factor in helping to stabilize things. I will say this. If you use the dosing on the bottles, you're probably not going to see a result. You do have to go to higher amounts. So talk with your provider, your practitioner whom you're working with about what would be appropriate for you.
Yeah.
Because you do need more. But I have seen people who couldn't have alcohol, all of a sudden, hey, I can tolerate having a glass of wine. And I was like, I didn't say you could have wine, but okay, I'm happy for you. But like, I don't think we were there yet. I was like, we're not there yet, but okay. They were on vacation, wanted to give it a go. They're able to tolerate higher histamine foods. They're less reactive. So it's not for life, but again, it's a nice bridge that helps get us more comfortable and give our body way more flexibility than what we originally started with. Also, I would highly encourage everybody, like vitamin C is amazing. But the other thing is look at your probiotics because some can be histamine producers. And so there are certain blends on the market that are lower in histamine. Lactobacillus rhamnosus GG has a lot of great research on it and tends to be very well tolerated. And it's available in all different formulas, whether it's a professional grade or something like Culturelle. So you have a variety of price points, but
we love it for the vagina too, everybody. It's very good for your down there ecology.
And it has to be the GG strain. It can't just be Lactobacillus rhamnosus. So those would be like some of my absolute favorites, I would say. But the immunoglobulins, as long as, again, you don't have a beef allergy because they're derived from serum, the blood of cows, unfortunately. But they are really, really helpful.
For somebody who has been dealing with chronic histamine issues, where would you advise that they start?
I would first start with the liver piece because I find that we have to think 5 steps down the road. What am I going to need to be ready for once I start dealing with some of the underlying issues? Like I talked about the gut microbiome, but you should never start there because if your liver's already overwhelmed, the last thing you want to do is start going after your SIBO and whatnot, because as you kill or rebalance what's happening in the GI tract, you now have more toxins. If you can't deal with what's already going on, the worst thing you want to do is now start throwing even more at the liver. So I do think starting with the liver is really important. Adding in some of these nutrients like the bioflavonoids like quercetin, immunoglobulins, maybe shifting up your probiotics can be really, really helpful. Talking with your doctor about what's happening and seeing if they can prescribe you something appropriate. There are mast cell stabilizing medications that sometimes can make a huge, huge difference in how you're able to tolerate food because, and I think this is a point that you were also kind of mentioning when we were just discussing diet and how limited it is, the more we reduce diet diversity, we reduce gut microbiome diversity and nutrient diversity. So the more we can keep foods in and get you back to eating a more quote unquote healthy diet that you like, that provides you nutrition, I think to me is like a really nice win. And you shouldn't have to wait like 2 years to get there. That should be a priority to be able to expand the diet as quickly as possible. I think those are really great places to start. And then considering, do I have any environmental allergies that are not diagnosed yet? And are there any other factors like mold or other environmental issues that you haven't quite considered at this current time that could be, driving some of these histamine problems?
Mm-hmm. Well, this has been so insightful. I really appreciate the information that you've shared with us, the unique perspective, and the fact that you have so much clinical experience helping people overcome histamine issues. It's been a real pleasure to have you share your knowledge with us.
Well, thanks for having me.
I hope you enjoyed this episode. If this is the kind of content you're into, then I highly recommend checking out this.